Imagine waking up with steady energy, clearer focus, and numbers that don't ping-pong all morning. Cutting sugar and taking meds matter. But there's a missing lever most people never pull. Vitamins that make insulin actually work, protect nerves and eyes, and slow the wear and tear diabetes can accelerate. Today, we'll dial in 3 overlooked essentials: B, 6E, and C, what they do, how to spot a gap, the best foods, smart supplement options, and exactly how to fit them into a normal day. No fluff, just practical steps you can start this week. Vitamin B6, nerve protector, metabolism helper when glucose runs high. Your kidneys quietly flush out more B6, add chronic inflammation, a common metformin side effect, and years of wear on the nervous system. And it's easy to end up low without realizing it. Why diabetics need it? B6, especially its active form, P5P, helps your cells access stored glucose smoothly, supports neurotransmitters' mood, focus, and is essential for hemoglobin, the oxygen carrier in your blood. Translation: steadier energy, calmer nerves, better healing clues you may be low, creeping, tingling, or burning in hands, feet, antsy legs, or cramps. Brain fog, irritability, mouth sores, dry, flaky skin, slower wound healing, and in deeper deficits, anemia like fatigue and dizziness. Best food sources you'll actually eat this week: chickpeas, hummus, stews, salads, wild salmon or trout, turkey or chicken thigh, sunflower seeds, and pistachios, beef liver, if you like it. Potent but optional how to use food first easy ideas. Chickpea bowls with olive oil, lemon, cucumber, herbs. Mis. Glazed salmon over garlicky spinach. Turkey scramble with peppers, onions, and a handful of sunflower seeds on top for crunch. Supplements. Keep it simple. Look for P5P, pyridoxal 5-phosphate. Typical maintenance ranges are 25 to 50 milligrams daily with a meal. If you're on multiple meds or already take a B complex, check the label and avoid doubling up. Very high chronic doses can cause reversible nerve irritation. More is not better. Smart. Pitfalls to avoid. Refined white grains and high-sugar meals burn through B6. Alcohol and some meds, including metformin and certain BP meds, can deplete it further. Food plus moderate supplementation closes the gap. Vitamin E, antioxidant shield for vessels, eyes and nerves. High glucose creates oxidative stress. Vitamin E is your cell membrane's armor. It stabilizes delicate fats in nerve cells and the retina, keeps vessels more flexible, and helps tame inflammation that worsens insulin resistance. Why diabetics need it? Better vascular flexibility, nerve protection, and less oxidation of LDL, a driver of artery plaque. Many people run low because absorption needs healthy fats and low fat. Highly processed diets don't deliver. Clues: you may be low, drier, slower healing skin, more frequent pins and needles, night vision strain, easy fatigue with muscle weakness, getting sick more often. Best food sources you'll reach for: sunflower seeds and almonds, hazelnuts, pistachios, avocado, olive oil over leafy greens, rainbow trout, sardines for the fat matrix that helps absorption. Simple ways to absorb more. Pear. Vitamin A-rich foods with healthy fat you're already eating: olive oil, avocado, nuts. 4 greens, don't drown them, so the fat-soluble E actually gets in. Supplements balanced approach. If diet isn't enough, choose natural D-alpha tocopherol, not DL, and ideally a mixed tocopherol blend. Common daily amounts: 200 to 400 IU with food. If you're on anticoagulants, have surgery scheduled, or a bleeding disorder, talk to your clinician first. Vitamin E can mildly thin blood at higher INTAKs. What to phase out? Industrial seed oils, heated hard soybean corn, and ultra-processed snacks. They increase oxidative stress and use up E. Keep the frying minimal. Roast or saute gently. Vitamin C, collagen, immunity, and insulin's wingman glucose and vitamin C compete to get into cells. When sugar wins, C struggles, then frequent urination flushes more away. That's why many diabetics run low even if they eat some fruit. Why diabetics need it? Collagen repair eyes, skin, gums, vessels, immune support, and insulin sensitivity via lower oxidative stress. It also helps regenerate vitamin E, creating a tag-team antioxidant effect. Clues: you may be low, slower wound healing, easy bruising, bleeding gums, frequent colds, creaky or tender joints. Low energy that coffee doesn't fix. Best food sources that don't spike. Bell peppers, red, yellow. Broccoli, Brussels sprouts, kiwis, strawberries. Citrus pear with protein, fat herbs like parsley, cilantro, big handfuls in salads, specialty powerhouses. Like acerola or kakadu plum are great if available, but not required. How to cook to keep it: lightly steam or saute. Long high-heat cooking degrades vitamin C. Raw peppers, plus hummus. Lemony broccoli or a kiwi with Greek yogurt are easy wins. Supplements: choose what fits your stomach. Ascorbic acid, reliable, budget-friendly. Try 500 to 1,000 milligrams per day in 1 to 2 doses. Buffered or liposomal. See if regular C upsets your stomach or you want gentler absorption. During illness or higher stress loads, short-term increases can help work with your clinician if you have kidney stones. History, or HEMOCHROMATOSIS. What gets in the way? Smoking, heavy alcohol, very high sugar loads, and overcooking veggies. Keep your plate colorful and your prep gentle. A simple daily plan ready tomorrow. Morning hydrate on waking. Breakfast anchored in protein plus fiber. Eggs, Greek yogurt, tofu, plus berries. Add bell peppers or kiwi on the side for vitamin C. If supplementing, B6, P5, P25 to 50 milligrams, and vitamin C 500 milligrams with breakfast. Midday big, salad with olive oil and a handful of almonds. Sunflower seeds for vitamin E. Pair with salmon, chicken, tofu, or beans for steady glucose. Evening cooked veg, broccoli, Brussels sprouts lightly dressed. Fatty fish or a lean protein. If you supplement vitamin E 200 to 400 IU, take with dinner to improve absorption. Anytime snack idea: hummus plus raw peppers, or Greek yogurt plus cinnamon, plus a few strawberries. Water, herbal tea, or sparkling water. Skip sugary drinks. Quick answers you'll ask: can I just take a multivitamin? They help with broad coverage, but often don't deliver enough of B6 in active form. Mixed vitamin E or vitamin C to correct a real gap. Food first. Add targeted doses where your diet falls short. How fast will I notice anything? Some people feel steadier energy and less tingling in 2 to 3 weeks. Structural wins: skin, gums, eyes, lipids build over months. Consistency beats megadosing. What about B12, D, magnesium, zinc, chromium? They're also important for diabetes. Today's focus is the vitamin trio many people miss even when they take the others. If you're curious about a full nutrient stack, test. Don't guess. Labs plus a tailored plan work best. Safety basics: if pregnant, on anticoagulants, have kidney stones history, or complex meds. Check with your clinician before adding supplements. Don't stack multiple products that each contain B complex and vitamin E. Read labels to avoid excess. Grocery list: you can screenshot proteins: wild salmon or trout, chicken, turkey, sardines, Greek yogurt, firm tofu, veg and fruit. Red, yellow bell peppers, broccoli, Brussels sprouts, leafy greens, kiwis. Strawberries, lemons, fats and crunch. Almonds, sunflower seeds, hazelnuts, avocados, extra virgin olive oil. Pantry. Chickpeas, hummus, cinnamon, parsley, cilantro. Supplements, if needed. P5, PB6. Natural mixed vitamin E. Vitamin C, ascorbic buffered liposomal, What to track for 2 weeks post-meal glucose peak. After breakfast and dinner, aim for gentler rises. Energy at 11 a.m. and 4 p.m. Less slump equals better nutrient balance, skin and gum healing. Frequency of colds and nerve sensations. Tweak food first. Then layer supplements. Conclusion: diabetes management isn't only about subtraction, less sugar, fewer spikes. It's also about addition, putting back nutrients your body burns through faster. Vitamin B6 steadies metabolism and nerves. Vitamin E shields vessels and myelin. Vitamin C repairs, defends, and quietly boosts insulin's impact. Eat them daily, supplement wisely, and give it a couple of weeks. Your meter, your skin, and your energy will tell you you're on the right track.